Welcome everyone to Kaiko's launch events. Whether you're watching live or catching this later, my name is Wouter Gude. I'm a principal advisor at M&E Partners, where we advise and lead projects on digital transformation in the healthcare sector and do annual research into the state of AI in Dutch hospitals. Now, one of the questions I keep hearing is, how do we move AI from pilot into something that actually sticks in clinical practice? And the AI monitor shows that hospitals really have ambition here. They start organizing themselves more professionally when it comes to AI. We see more AI implementations at slightly an even larger scale as well. But what's harder to find, however, is what it actually takes to make it work. Now, today's session is hosted by Kaiko, an AI company that I've watched up close and that has built something that I've really wanted to see demonstrated, which is clinical AI that works in a real hospital, creating real impact. It's exactly this kind of initiative that convinced me that it was worth having this conversation in the open with people who've actually lived it. Now, let me give you an overview of what you'll see today. We'll start with a panel with hospital leaders who took AI from exploration into daily clinical use and are willing to talk honestly and openly about how they've made that happen. Second, the Kaiko team will launch and give a demo of their new product. And finally, a fireside chat with a surgeon of the Antonie van Leeuwen Hospital on what changed for him and his patients when Kaiko became part of how he works. Let's get started, and let me introduce to you this very interesting panel we have here. We have Maurice van der Bos, who is chairman at the Netherlands Cancer Institute. We have Annemarie van der Veen, the lead of the AI accelerator at the Erasmus Medical Center. And Tim Jansen, critical care specialist at Hagen Ziekenhuis and also founder of the Zorg met AI initiative. And Thomas Hoefener, CEO at Kaiko. Welcome.
Thank you.
And I'd like to start this panel with a finding of the AI monitor, this year's AI monitor. We've seen year after year a lot of AI pilots and implementations with high expectations, yet limited realized impact. One finding of this year's monitor is that the number of hospitals with an AI strategy has doubled to nearly half of the hospitals now have an AI strategy. And I'd like to ask every one of you in one sentence, what do you think is behind that, Maurice?
I think the most important reason is that we realize now that it is not only digital technology implementation, but it is really a culture change that you have to make with your physicians, with the nurses, and to have this transformation of culture, you need to have it in your strategy as an institute. I think that's the main reason.
Annemarie.
Yeah, and to add on that, I think hospitals now acknowledge that they need a strategy that fits their context, because we can do a lot of AI pilots and projects, but you have to have a good match with the context of the hospital itself. Otherwise, you are lost in a lot of fuss. So I think it's a good movement. Yeah.
Lost in AI.
Lost in AI, yes.
Tim.
Yeah, without an AI strategy, which is in line with a hospital strategy, AI stays stuck in isolation. You will end up having point solutions and AI will never scale.
Thomas, do you have anything to add from your point of view?
Yeah, I think another important factor is that the underlying AI technology has evolved from initial narrow AI solutions to a lot more powerful AI. So also on the technology side, there's a lot more possible today than, let's say, 3 years ago. So I think on the one hand, it's the strategy in the hospital. Hospitals are more ready, but also the technology is more capable today.
Thank you. Maurice, I'd like to move back to the moment where AI pilots became realization. The Netherlands Cancer Institute has moved AI from pilot into clinical daily use. And could you tell us what was the moment or the decision that made that real?
We are facing a huge challenge. We have a shortage of employees. We have an overload of requests for healthcare, and it will increase the coming years tremendously. If you look at, for example, cancer, one out of two citizens in our country will face cancer during his or her life. So we discussed also with Thomas and his team, can we invest in digital technology to solve to bring a solution for the gap between the demand for healthcare and the workforce that we have. So we shifted a little bit more than 2 years ago from project management, and like you mentioned, more point solutions, more single projects, towards a more strategic approach to solve this problem, to really redesign how we deliver care for our patients. And we brought our teams more closely together to come up with new infrastructure, new design of care pathways. And I think that this is typically a problem that we want to solve together. So that was the major shift also towards the clinical staff, to get more buy-in, that this is really not a extra hurdle, but it is a potential solution.
Thank you, Tim. Buy-in and get people together. You're the founder of Zorgmet AI at Hagen Hospital, a startup within the hospital. Could you tell us something about what it is, why you started it, and how it gets clinicians to use AI ultimately?
Yeah, Maurice just mentioned it. It's very important to have buy-in from the work floor, to have doctors and nurses really adopting the transformation. And we took a kind of different approach, and there are various possible approaches. I mean, we took the approach with the internal startup called Zorgmet AI, and I think it has got two main advantages. The first advantage is that we can speed up. We can be agile, we can have real traction. It's very difficult to change big organizations, sometimes being very conservative, not without a reason, obviously, but it's difficult to change. And it's more easy to change in a startup way. And you can compare it with Tiki and ABN AMRO, for instance. So that's the first advantage. The second advantage, and now coming back to the buy-in, is how do you involve the doctors who need to change, who are willing to change? And we thought, well, we have to talk with our own medical staff. So I have been part of the medical board for almost 5 years now. And we decided to really invest not only in people, but also in finances, to invest in the technique that we would like to make possible.
You put your money where your mouth is.
Skin in the game.
That's it. Does that match what you experienced at Netherlands Cancer Institute from a leadership level also?
Well, I think it's spot on. Also, the return on investment, or I think what we often discuss less is what you can call the quadruple aim. So you invest in technology, you invest in a new way of work, but what did it deliver in the end?
Absolutely.
Towards patients, if you look at quality improvement, for example, or accessibility of care, experience for patients, but also for the professionals. You know, is it a reduction of administrative burden, for example? Do they experience a better conversation with patients due to technology? And in the end, that was also mentioned, what is it if you look at cost savings and revenues? Perhaps more down the line in the care pathway, but in the end, it needs to be at some points in the quadruple aim of interest to make the investment.
Somebody has to be willing to pay for it in the end somewhere, and that's very often is lacking. Yeah.
But I think if you look at the outcomes, that for example, we had a discussion this morning. What the effect is when clinicians use it in the office for outpatient visits, in the reduction of preparation time. That is time that they can spend with their patients, like we are having the conversation, and not behind the boards and behind the computers, but really having the right discussions. And I think if you can quantify the outcomes, that helps the adoption of the technology broader in the staff, I think. Yeah.
Absolutely.
Yeah.
So it's a time saver, and it allows to have the better conversation with the patient because you're better prepared.
Yeah, in this example.
Annemarie, you also mentioned that someone has to pay, and if it's just time saved, where we speak more to the patients, what is the financial benefits?
Yeah, I think for me personally, from a perspective from the boards, I look at the impact on quality outcome first, because in In the beginning, you need to invest in innovation and have a long roadmap, convinced that you will succeed in solving a certain problem, for example, accessibility of care. If you look, for example, at diagnosis and diagnostic imaging, if you are more accurate, if you have a first-time right diagnosis, it is not necessarily in the beginning that you have a cheaper care pathway, but can you imagine what it implies for patients when you have the right diagnosis immediately instead of in certain phases? I think if you become transparent on outcome, on results, then the improvement starts, and then you find also solutions for make it of interest for the right reimbursement. But I'm not a financial by background, so perhaps some of the colleagues will have another perspective, but in the beginning I look at the improvement of quality for patients and physicians or nurses who needs to work with new technology.
Right. And Thomas, we mentioned that it helps the adoption when the AI will have impact on the quadruple aim. It helps reduce resistance. And from your perspective, can you add something? You know all these hospitals, in what helps to get clinicians and other staff to get beyond resistance into adoption?
Yeah, I think there's many factors here. So there's also many stakeholders in a hospital. I think it's important that there's buy-in from management level or leadership level. There's a longer term vision behind it or strategy. I think it's important to have a number of clinical champions that really like experimentation and early adoption. I think it's also important that this is to be aware that this is new technology and staff needs to be trained and needs to be onboarded. It's still early in the AI revolution. So I think board buy-in, clinical champions, training and an onboarding program, and ultimately, of course, also financial return, which I completely understand, but that needs time to be proven in a hospital.
Annemarie, how do you go on building a business case when the impact it will deliver is so uncertain?
You see, people believe in it, but you have to start in the beginning to have some guesstimate on the value that it's going to bring in the end. And of course, that's not unique for AI. That is every innovation project actually. At the beginning, when you start something, somebody has an idea and he says there's some value in it, and you have to believe in that and make a guesstimate. And the moment you go further and you invest more money in it, then this guesstimate has to become more and more clear and more correct, actually. So it needs to go from a guesstimate to a real business case in the end. And that's actually, so it grows with the project, and that's how it's supposed to be done. It's not always easy, but that's, I think, the way it should be. We should do it.
And in addition, I think what you mentioned, if you have learning from excellence, that you bring the results and the wins in the staff and share it, then you invest in the buy-in, of course, of more and more colleagues. So you start the movement also by bringing on a regular basis the results into.
If you look at innovation projects, then actually 10 projects you start, only 2 have to be a success, and you can really stop the 8 and say, we learned. It's a failure, but we learned. But the return on investment at the end needs to be on the whole investment portfolio and not on every single project. And that is something which is really difficult in a hospital, actually. But that's, if you look at innovation management in general, then return on investment is on the whole innovation project portfolio.
That's an interesting perspective. Innovation can fail as long as we learn from it. And
it will fail sometimes.
Do something with the learnings. You're also a university medical center. Tim, do you make similar choices?
Yeah, and to extrapolate a little bit further on what Maurice and Annemarie just told us about showing the successes, but also showing the failures. I think it's in innovation, it's about showing what you have accomplished and what you have not accomplished. I mean, it's not wrong if you have a failed experiment. Just show what you've been doing.
Thomas, AI has to be many things. It has to have an ROI. It has to be ethical, responsible, impactful. Where have you seen that AI has had an undeniable value case within these hospitals?
I think in any company and in any hospital, innovation and transformation takes time. So it's important that hospitals get enough money and enough time and a long enough horizon to invest. Because short-term ROI is very difficult to measure. Over time, the advantages will be apparent and they will accumulate. And the technical readiness is important, the staff readiness, the cultural readiness, those are all investments. And I think that it's important that health insurers and governments support hospitals by giving them enough budget to be able to invest. And over time, the technology will prove itself. I have no doubt that that will happen. But hospitals are still in the adaptation phase. And the good thing that what we see and what we have seen has really changed in the last few years is that clinicians start to ask for it now. Mm-hmm. And that's really different today than, let's say, 3 years ago when everybody was very skeptical.
You wanted to add, Tim?
You mentioned that the clinicians starting to ask for it, but sometimes it's one clinician asking for a niche solution or niche product. So we have to be honest as well. We have to have this discussion with, let's say, a really problem-based and also value-based approach. What is with 20% of the effort, 80% of the value which gets extracted? Otherwise, it will not be funded in the future. And sometimes we need to be honest on that.
Exactly. Thank you. When we run the AI monitor next year again and we see increased impact, what do you think will have made the difference? And I'd like to hear from everyone of you. Alice.
Well, I think we are here also, of course, in collaboration now with kaiko. I think it's so important to build strong public-private partnerships. I mean, kaiko has the expertise. If you look at data scientists, if you look at data architects, I mean, on a level that we will not have in the hospitals. In the hospitals, we have the clinical knowledge. So I think it's really the merger and the collaboration on a national, but also on a European, international level, that will make the big difference. We should invest more and more in these public-private partnerships. I think the future really looks bright in that sense.
Annemarie?
Yeah, what would make the difference? I think, well, first of all, I think what you said indeed is that workers, employees from all levels are more aware. They use it in their daily life, so they are less reluctant to use it in their work environment as well. So it becomes more and more something we know how to use and we know we are more familiar with. And I think that is going to be a big difference. The thing which is happening in society in general will also flood into the hospital care. It's not going to be easy, but I hope that's the movement. Yeah.
Yes, thank you. Tim?
I would say two things. First, there is the technical part, so the data infrastructure, data governance, AI literacy. I mean, this needs to be in place. And then there's the human factor. And that's like, we need to be ready for such a disruptive transformation like AI. And we should open up. And also have a look at someone else, not only hospitals. And maybe it's a little bit provocative, but I was on my way to Amsterdam with my Tesla, full self-driving, supervised, and people told us full self-driving will not be possible in Europe until we solved liability, for instance. And now it apparently has reduced major and minor accidents. So maybe this might challenge us to go from the administrative tasks we can apply in the AI field to the real clinical field.
I'd like to thank every one of you for this very interesting panel. Thank you. And we'll move over to the kaiko team and we'll see what they'll launch today.
Clinicians work under heavier time pressure than ever. More patients, more data, more treatments, and more decisions to make. That's why kaiko builds AI to support them.
Earlier, what does a day in the life of a doctor look like?
You get in early and you leave late, and a big part of the time in between isn't actually care. It's about searching information, gathering results, filling out requests, writing up notes, letters, reports, double-checking, waiting, and so on. And I think doctors, nurses, everyone in the hospital is searching through hospital systems, trying to piece together a picture that already should be there. And I really can't help thinking, should it really be that hard?
Kaiko turns fragmented information into the right patient story for every moment of care. It helps clinical teams walk through any case, not just search for information. From outpatient clinic to complex MDT, the patient story is ready before you walked in. And the more you work with Kaiko, the better it gets.
Very soon, every clinician will have an AI coworker that lives inside the clinical systems, and this coworker will then be able to join the tumor board as a participant. It will be able to read imaging alongside the radiologist, and it will catch patterns that nobody really had time to find.
People ask me why we're called kaiko. Kaiko was a deep sea explorer, and its mission was to reach the deepest parts of the ocean and surface what was there. Our goal is the same, to help clinical teams surface information that's not yet visible and make sense of what it means.
What you just heard in the video, the searching, the switching between tabs, building up each patient's story every single time, this is exactly why we built Kaiko, the clinical AI workspace. And today, we're excited to share it with you. This didn't happen overnight. We have been working over the past few years with clinicians, testing our AI in real hospitals with real patients. Our workspace is already live at the NKI-AVL, helping clinicians to reduce prep time and mental load. And today we're taking one step further, introducing the workspace for consult preparation, MDT preparation, handover, registries, discharge. Now let's look at what it means in practice. You bring up a patient and you ask Kaiko what you need. Kaiko reads everything: notes, referrals, imaging, labs results. It pulls together what matters to you right alongside the EHR. And it does all of this using your hospital's own guidelines and protocols. One key aspect is that every document, every claim, every answer links back to its source. You can look at the steps that Kaiko, the agent, took. You can inspect the citations and you can change everything. Nothing is a black box. And the clinician is always in control. You can review, you can edit, you can steer, you can decide what to use. Kaiko is designed to support your judgment, your thinking, not to replace it. And Kaiko is configured with you. This is one AI workspace for any clinical task that matter to you, your department, and your hospital. But the best way to actually understand how it works is to see a demo. And now, over to you, Floris.
This is what a typical hospital's EHR looks like. Now, if I prepare to see a patient, it's like reconstructing a puzzle. I need to know who they are, what the context around them is, and why they're actually visiting me today. The information that I need to do that, it is somewhere in this system, but it's spread across multiple pages and tabs. For instance, here, I've got all the letters that were sent from another hospital as referral information. And then if I open yet another tab, it's going to take a second to load. We've got the pages upon pages of clinical notes that we have on record for this patient at our hospital. Now, I owe it to this patient to be fully prepared for seeing them. And what I would end up doing is manually going through all these notes and then picking out what's relevant to me, copying that to a new document and bringing that with me to the consultation. With Kaiko, this experience changes entirely. It's integrated into my EHR, so I can open it straight from there. It takes me straight to this patient's page in Kaiko, which allows me to start a new session with this patient. Now, how would I prepare to see this patient with Kaiko? With one simple action, I can ask Kaiko to prepare this consultation. And immediately I will see what Kaiko is doing and why it is doing that. The steps that Kaiko takes are shown to me transparently, so I can follow what it's doing, which patient documents it's actually reading, and any special actions that it's taking. So this is going to take a few seconds to compose the patient overview for me. When it's done, I'm presented with a comprehensive overview of this patient that is completely tailored to this consultation. It's everything that I need to see, no more and no less. With every medical fact that's on the page being traceable back to an original source for me to read, check around, then close and go back to the overview. So this is a superficial representation of this patient with deeper access to this patient's information on demand. For this oncology case, their cardiology history is relevant to the direction of the treatment. So I'm going to select that history item and ask Kaiko to look deeper into that and give me the details of that 2019 event, and also tell me how it relates to today. Kaiko has looked into the entire medical history of this patient and presents me with an overview of that 2019 event. It explains to me in the language that I'm familiar with what happened and how it relates to today. Now, Kaiko knows general medical guidelines, but what's maybe even more important is how it knows my hospital. It knows my local protocols, and as such, I can ask it to look at those. So I'm going to type a question to Kaiko and say, look up our protocol here. And we're going to give it a second to find the right protocol and how it relates to this patient. Once it's found the protocol, I don't only see the medical details that I need, but also the very practical next steps that I need. And in this case, that is, how do I actually bring this person into our Thursday MDT? The final step before the consult is that I want Kaiko to create me a written consultation note that I can take with me and complete during the consultation, and afterwards store that again. So again, I'm going to ask it. Now, Kaiko is going to create the note for me, and it's going to pre-fill it with the patient information that I need during the consultation. I can work in that note during the consultation and store it afterwards. Preparing for a consult with Kaiko is just so much more comfortable than doing it manually. We have scientifically validated that doing it in this way saves 1/3 of the preparation time. With Kaiko, I'm in command and the agent thinks with me. It gives me the puzzle pieces that I need, and it creates trust through showing the underlying process and the sources when I want to see those. Now, these are just some of the basic things that Kaiko can do for me today. But this same principle applies to many more care moments, such as follow-up appointments, multidisciplinary team meetings, inpatient admissions, discharge letters, referral letters, and so on. Because ultimately, all the information that I need to do these things is already out there somewhere, but it's just not coming to the surface. And that is where Kaiko brings the intelligence and the clarity to clinicians. And now, back to Wouter.
Thank you, Kaiko team, for the demonstration. And now we're moving to the fireside chat. And I'm speaking with Michel Wouters. Welcome.
Thank you for the invitation.
You're a surgical oncologist and also head of the division of surgical oncology at the Antonie van Leeuwenhoek Hospital. You're also a professor of quality of care at Leiden University and moreover, AI enthusiast. And I'd like to ask you, could you take us back to the first time you were using Kaiko before a consultation and tell us what was different?
I'm a surgical oncologist in the Netherlands Cancer Institute, and I'm seeing melanoma patients. I'm specialized in melanoma patients, and a lot of these patients are referred from other hospitals. And a lot of information is sent with them to our hospital, and they are scanned into the electronic health records. And when I prepare my outpatient clinic, of course I have to read all this information. And it takes a lot of time. And the first time I used the Kaiko app, I was really amazed that in one click with the button, you see all this information structured from who is referring the patient, which hospital, what is the patient's history, its comorbidities, medication use, and of course the pathology report is really, it saves a lot of time because you have this case in your head immediately. So you still have to read all this information, but because you are prepared for it, you can extract the important things much easier than when you don't use the Kaiko app.
And what has actually changed since you started using Kaiko for you or for your patients?
It saves time, especially for the preparation. A lot of colleagues and we often prepare our consultations the night before in your free time. And then you are preparing for at least 1 hour, 1.5 hours, your morning outpatient clinic. And now much less time than before. And I think also during the consultation, you have much more time with the patient. One of my students, my PhD students, Willemijn van Koevoorde, she validated the tool and she did also research for the time saved by the Kaiko app. And it's from 8 minutes, it went preparation time, it went to 2 minutes. And that's important time because for one patient you mostly have 15 to 20 minutes, and when you have 5 minutes time saving, you can use the time for the patient.
That's quite some time saved. Do you experience any other effects besides time saving?
I think in general AI is helping us to get information much faster. Just for when you have to look up information in a difficult case, you can use large language models to seek for the right information, and still you are still responsible and accountable for the correctness of that information, but it really saves time in looking for the right information, that you are directed to the right source. And of course you have to read the source yourself, make the professional decision on it.
And could you say that using AI or the Kaiko app will also identify more information than you as a clinician would otherwise manually find, because it can look everywhere through the EHR?
Yes, through the EHR, but also, for example, we use Senya in our hospital and all the protocols are in there. And there is thousands of documents. There's no any doctor that has all these documents in his head. And when you have to look up for a patient that uses anticoagulants and you have to look up how do I bridge this during an operation, you have to go to Xenia and find the right information for this patient. And I think in the further development of such a Kaiko app, you can present this information much easier to the doctor in the consultation room. Of course, you can go to the document yourself and read what is exactly in the document, but it's much easier than to look up at another system.
Could you go as far as AI will save some lives?
I think it can improve patient safety. Yes, and we see that also in other domains already. In radiologic imaging, there's a second reader that's AI, and it says there's an embolus in this right arterial vessel. So it can help us to give safer healthcare. Yes,
like a second colleague or an assistant. Yeah. And looking ahead, Michel, where do you think this is going? What do you think AI will bring us in the next couple of months, or maybe at even a further horizon?
Especially, I think, for language models in the electronic health record, we know that what we report in the electronic health record is mostly narrative. And we just write down what we think. We would like to use this information for research, for quality registries, etc. And what you see is that these language models can also structure information for us and help us for the reuse of data for different purposes. So I'm very optimistic about that the registration burden, not only the administration burden, but also the registration burden can be reduced with language models. And for the further future, I think in 5 years, I think, for example, in our NDTs, we discuss individual patient cases I think AI can help us then with the structured data of patients that have been treated before to present us objective information about the outcomes of patients that have been treated before and that are similar to the patient that we discuss. We call that patients like me. I think this objective information can help us to make treatments much more personalized, also for subgroups of patients like older patients or patients with comorbidities, and improve quality of care with this information.
Sounds like we're only at the beginning and we have a lot of beautiful things to look forward to. I'd like to thank you very much, Michel, for your conversation. And I'd like to come to a close where we started out with a gap today between the ambitions that hospitals have when it comes to AI and impact that's being realized at the moment. And I hope that after you heard everything and seen everything today, this gap will feel a little smaller and a little less daunting. I'd like to thank all the speakers today for their openness, their honesty. It's conversations like this we need to get further when it comes to AI in healthcare. And I'd like to thank you, our viewers, for watching. Have a great day.